is Clara. I'm a member of the Adaptation, Performance and Human Development Research Group, and I'm going to talk about psychological distress on nurses. Occupational stress in health professionals has become a matter of public health due to its negative effects on mental health, in such a way that occupational stress has been called the plague of the century. In their work, nurses have to deal with several hard burdens regarded as high psychological and physical and emotional demands, allied to a reduced degree of control and rewards. They have to deal constantly with life-threatening events and adversity, which has been related to poor mental health and the expression of psychological distress. So, in our study, we sought to explore the role of personal and professional variables on nurses' psychological distress, and to do so, we established three main goals: to explore the relation between the personal and professional variables and psychological distress, to identify risk factors for clinical symptoms of psychological distress, and to identify risk factors for anxiety, depression, and social dysfunction. The measures used were a social demographic questionnaire and also the Portuguese version of the General Health Questionnaire. Our sample was constituted by nurses working in Portugal that completed an online questionnaire. In terms of results, significant differences were found between nurses with and without clinical symptoms in terms of personal and professional characteristics. Aside the highest age, we found more clinical cases in women rather than in men. On the contrary, a higher incidence of nurses without clinical symptoms was observed among those that reported having a hobby, that performed physical exercise, and in those nurses that worked in the hospital setting. The experience of anxiety depression was significantly higher in nurses with no hobby. However, social dysfunction was higher in single nurses with no hobby and in those with a permanent full type of contract. Findings show that working in primary health care, having a hobby and do not do physical exercise behaviors constitute risk factors for clinical symptoms of psychological distress. We also found that being older and having no hobby and no physical exercise behaviors constitute risk factors for anxiety, depression, while being single and having no hobby constituted risk factors for social dysfunction. So, nurses with clinical symptoms showed a worse psychological profile, expressing more anxiety, depression, and social dysfunction. Significant differences were found between nurses with and without symptoms of psychological distress. Working in primary health care constituted a risk factor. Results can be understood in the light of the role of the family nurse, which implies a broader and demanding field of action, which should be considered by health organizations. Leisure activities may be a protective factor for nurses' mental health. So, in order to ensure patients' safety and the quality of health care, health organizations must consider nurses' characteristics that are related to their mental health and global functioning. Findings point to a professional group that requires reflection and consideration, highlighting the role of leisure activities for nurses' mental health. Thank you so much for watching this video. If you need to contact me, just go to our website and click the option Member or Contacts.